Hello and welcome back everyone. Hyperplastic pulpitis, or otherwise more commonly known as the pulp polyp, is a type of irreversible pulpitis that originates from a chronically inflamed pulp. A pulp that has been in inflammation for a very long time. Hyperplastic pulpitis is usually found in teeth of young individuals, especially those young children whose teeth have been caries for a very long time. So as we have studied in our previous lectures, a tooth with a caries lesion first goes from reversible pulpitis and then to irreversible pulpitis if the cause is not removed in time, after which the eventual outcome of pulp will be pulpal necrosis. Since the pulp polyp is a type of irreversible pulpitis, the signs and symptoms are also similar to the irreversible pulpitis. Pulp polyp is usually asymptomatic, or it can also have signs and symptoms. Symptoms include spontaneous lingering pain just like those of irreversible pulpitis. There is, however, a special appearance associated with the pulp polyp. There is a large cauliflower-like outgrowth of connective tissue into the caries that has already resulted in large occlusal exposure. This outgrowth is essentially coming out from the pulp from the area that has already been exposed to the oral environment, which looks like a polyp and hence the name pulp polyp. This outgrowth is a classical sign which almost confirms the diagnosis of the pulp polyp. Treatment for pulp polyp requires removal of the diseased pulp. This may involve either performing root canal treatment or, in worst cases, performing extraction of the tooth in order to relieve the patient from their painful experience. Now let's do a simple clinical question to understand the topic better. A 7-year-old male patient came into your OPD with pain in his 3/6. 3/6 meaning that it is the lower left molar in the FDI system. Upon further questioning the patient, you find out that the pain has been present for about 4 months. At first, the pain only started while eating food and the pain ended quickly once the mastication was over. But after a few weeks, the pain began to start spontaneously on its own and also started to linger for minutes and even hours before dying off. This has been going on for about 4 months. Upon clinical examination, you find out that there is a cavity on 3/6 with a small red cauliflower-like outgrowth coming from the small cavity. What is your best possible diagnosis? A. Hyperplastic pulpitis, B. Irreversible pulpitis, C. Reversible pulpitis, and D. Gingivitis. So you have 5 seconds to read the question once again, and then I'm going to try to explain the correct answer in detail. So based on the information we are provided in the question, gingivitis is the least likely answer since the symptoms are not even close to gingivitis. Now as we know that reversible pulpitis is an acute inflammatory condition, but this patient has been experiencing pain for about 4 months. So reversible pulpitis is also out of the question. Now according to the history provided, it is surely an irreversible pulpitis case, as young patient is experiencing pain since 4 months, hence most likely a chronic pain. And to cement that, there is also a history of spontaneous and lingering pain being experienced by the patient. So it is most likely an irreversible pulpitis case. But there is also a very important clinical sign, that is a cauliflower-like outgrowth. And the cauliflower-like outgrowth along with other signs and symptoms is a classical sign of pulp polyp or the hyperplastic pulpitis. So the correct answer will be A. Hyperplastic pulpitis. It is not that B. Irreversible pulpitis is the incorrect answer, it is just that considering all the findings given to us in the question and also the options given to us, the best possible answer and diagnosis will be pulp polyp or the hyperplastic pulpitis. So we always need to read all of the options that are given to us since we need to choose the best possible diagnosis. But in this question, the best possible answer is hyperplastic pulpitis. Since in the information provided to us in the question, there is also a cauliflower-like outgrowth present on the 3/6. So the best answer among irreversible pulpitis and hyperplastic pulpitis will be hyperplastic pulpitis. So this was a short lecture on hyperplastic pulpitis. If you want to see my previous lectures on irreversible and irreversible pulpitis, the link will be present in the top right corner and also in the description. So I will meet you people next time in my next lecture. Till then, take care of yourselves and your loved ones. Stay safe and goodbye.